On Dr. Samahir Abuaraki, presenting inhibition of proximal muscle after an ACL injury with the help of dry needling.
صباح الخير. كيف كويسين؟ نعسانين ولا؟ Yeah? Can we stand up بس for a while? كلنا stand up stretch. أنا نعسانة. I don't know about you. let's stretch it out عشان الفطور. As a physiotherapy. Yeah, stretch up and stand on toes. Yeah. صباح الخير. يلا كده يا دوم. يلا we can sit down. So, today I'll be talking about a case study that I've been treating in a proximal muscle inhibition resulting from ACL injury using trigger point dry needling. So basically, let's just talk general about the dry needling. What is the dry needling? Dry needling, we all aware about the word dry needling, صح? So it's microfilament عندها different sizes according للmuscle area. يعني للgluteus maximus مثلا is the big outer muscle, so we need long needles عشان we want to reach myofascia, we want to reach المyosin acting where there is trigger point. So we use different dry needling according to the area or according to the amount ذات بتاعت the trigger point بتاعتنا. In my case, I used my patient. She had ACL injury, so she came. And I'm specialized in sport. My area is a knee. So she came to me complaining about the instability of the ACL injury according with the instability and the pain and the range of motion limitation. She had tenderness and swelling and all the clinical features للناس التاين ACL. So I was focusing on that. The moment I asked the patient, because she had so much instability, I asked her to wear the brace, الفيه opening in the patella قدام. Then immediately she felt the relief. Then it was all critical thinking. I was thinking, what is I treated the vastus medialis basically. Because as we all know, الhip والknee, they're connected, صح? عندنا الquadriceps قدام, عندنا الhamstring ورا, right? So the quadriceps عندنا the longest muscle اللي هي two joint muscle اسمها the rectus femoris. So it's called also the kicking muscle. So if I want to kick someone, so I do this movement. I flex here and I extend there. So this movement is coming from the rectus femoris, is the one of the quadriceps muscle. But then عندي الفاستسات, vastus medialis, vastus lateralis, and vastus intermedialis. Each one of them, they work together in harmony عشان يعملوا extension of the knee. But the most interesting one هي الvastus medialis. This is أنا لعبت في الحتة دي. So why? Because the vastus medialis عندها big role in the patellar maltracking. So whenever we're walking, بيحصل a little bit of rotation in the knee. So الباتيلا دي, whenever I'm doing flexion and extension, الباتيلا it goes away from the groove, and then the vastus medialis it pulls it in عشان ترجع back للgroove بتاعه وللهون. So every single movement I'm doing, الباتيلا دي بتتحرك لي and it goes away from the groove بتاعه, so the vastus medialis pull it back. In some cases, patients come complaining of the medial knee pain. فبقوم بيقول لك I have medial knee pain, so you do all your special tests بتاعت medial collateral ligament and medial meniscus, you check a joint line, you check ACL, and mostly of ACL بيكون عندنا medial. All the tests will tend to be negative. So we have to go beyond that, and then we have to check الvastus medialis. ليه؟ لأنه whenever this vastus medialis is tight, it pulls the patella, فبقوم بيحصل لها friction on the medial side. So the patient comes complaining, I have pain here. ليه؟ لأنه الvastus medialis is so tight that it's pulling الباتيلا. So بتقوم بتحك في الحتة whenever every flexion and extension, every single move the patient is doing. So بيحصل لها فيها friction that causes a medial knee pain. So we have to work not only on the joint line, we have to work on the muscle. For the vastus lateralis as well, we have to check برضو the hip. we have to check all the neighboring joint, no matter what in the hip proximal. And if a patient came to me, and I'm just explaining because this is just one case study and I did, and I just want to أرسل لكم الحاجة اللي أنا عملتها. Yeah. So if the patient came to me having like gluteus pain, so gluteus هم 3 maximus, the bigger outer one, and then medius, and then minimus. So في ناس بيجوا بيقول لك إنه أنا have lower back pain ولا عندي disc prolapse. لكن في 99% of a low back disc ده it's not disc, it's piriformis syndrome. ليه؟ لأنه البايريفورمس I know إنها هي بتكمل لي من الساكروإيليك تحت اللمبوساكرال بتمشي لي للجريتر to the counter of the hip. So whenever there is tightness of this muscle, it presses على السياتيك نيرف بتعمل لي سياتيكا. بتديني بس إنه symptoms زي نفس النيورولوجيكال symptoms بتاعت النمنس والtingling. So we think إنها هي it is sciatica, but it's not sciatica لأنه الكمبريشن ما جاي من النيرف روت فوق في الفرتبرا. It's coming from إنه piriformis muscle is tight, so it's pressed على السciatic nerve, causing all the neurological symptoms. And then why it's affecting the back؟ لأنه الأوريجن بتاع المسل أصلاً جايين منه من lower back. So whenever there's tightness, it pulls من الأوريجن, it pulls من الانسيرشن. فبيكون بيحصل ليش no rotational dysfunction up in the back. That's why the patient comes to you complaining, I'm having lower back pain, well, this is disc. But if you check the proximal areas, if you check, for example, the piriformis, if you check the hip, you will understand that he's not disc, it is not mechanical low back pain, it's just rotational dysfunction حصلت لي من muscle tightness. So it's all muscular, ما عندها حاجة neurological. So we have to do proper assessment and evaluation to rule out the main diagnosis. إحنا will be having a lot of differential diagnosis. Then most of the patients, they complain about the same things. The patient comes to you complaining إنه أنا ما قادر أصلي الألم وموقفني عندي ورم بيجي on and off. So it's the same symptoms. So that's why we have to do a proper functional assessment. This is where we fall. We treat a person functionally. إنك أنت you're not able to pray ما قادر تنزل, so I want to treat that. So you see a lack بتاع movement and then you work on that. Exactly like how I did with my patient. Her main problem was the ACL. And like for me, after I worked on the proximal, on the hip, and I did the dry needling for the vastus medialis, her pain, her range, everything improved. Like what didn't improve? The instability. Why? Because she had 2 problems. الهيب كانت أول, which is كانت dysfunction coming from the knee pain. So I treated the vastus medialis, I did the needling there, combined by different stretching exercises. So the main role of the vastus medialis أصلاً إنها بتعمل لي extension, right? يا دكتور معتز؟ تعمل لي extension of the knee, and then تعمل لي البتيلا mal tracking ولا it tracks البتيلا, it pulls the patella back to the groove. It helps as a synergy أصلاً بتعمل لي إنه adduction and then internal rotation. So this is all for the muscles. And we don't have to think about best muscle. We have to think about the agonist and the antagonist, because they have to contract at the exact same time, صح؟ لأنه لو some muscle pulled more than the other بيكون بيحصل لي tear. So whenever we're treating the quadriceps, we have to consider the hamstring as well, صح؟ لأنه everyone, like when the quadriceps is concentrically contracting, الeccentric contraction بتاعها بيكون شنو؟ الhamstring. And then when I worked on the knee also, for this patient, I saw the hamstring because it's semitendinosis, semimembranosis, and biceps femoris. So احنا عندنا 2 bone, they're coming from up, and then 2 bone, and then tibia or fibula down there. So one goes to the semitendinosis, I guess. It goes to the tibia, and then the the rectus biceps femoris, and then one comes in front. عشان they hold the knee as a whole عشان يعمل لي this movement, the flexion movement. So I need those 3 muscles to work in harmony مع بعض عشان يعملوا لي شنو knee flexion when it comes to the hamstring. لأنه if one pulled tighter than the other بيقوم بيحصل لي dysfunction ولا shifting, and then بيحصل لي tear ولا بيحصل whatever it is. Okay, this is the general idea about what I did. For the patient itself, I worked on the knee. I told you like the limitation of the study was the instability was not corrected. لكن what I made the patient do, I made her wear the brace اللي عنده فتحة قدام بتاعت البتلة, because I won't ask the patient to go and rest, right? I want to engage the patient. I want the patient to be as active as she can be. So I made her wear that brace. I stabilized the patella. So أنا عملت الفانكشن بتاعت الفاستس ميدياليس بالبريس ذاته. And then I asked the patient to do the movement, كل الفانكشن الاكتيفيتي اللي هي بتعملها. Okay? And then I worked also, I did all the manipulation or joint line release, whatever it is. Because every synovial joint في جسمنا, it changes the viscosity بتاعتها بحاجتين. Either temperature ولا pressure. That's why يعني كل synovial joint في الهيومن body هي عشان هي فيها synovial fluid, it changes the viscosity بتاعت الجوينت ذاته يا اما either by the pressure ولا temperature. عشان كده لما يكون عندي pain انا بقول لك apply hot bath. يعني why I say hot bath يعني انا I really literally want you to warm up a synovial fluid لانها هي بتكون ثقيله, الفيسكوسيتي بتاعتها بتكون thick. So I want the thickness that تبقى لي حاجه خفه عشان it allows me to move freely. So that's why I'm telling you either you warm up by doing exercises شوية لحد you sweat ولا you apply hot bath عشان to change the viscosity بتاعت synovial fluid دي من إنها هي thick تبقيها لي thin, and then I will increase the range of motion ولا الharmony بتاع movement ولا السموثنس بتاعت movement. يا إما the second thing it changes قلنا temperature ولا the pressure. As a physiotherapist نحنا ولا actually the chiropractor they're good at that. إنهم they know the exact amount of pressure they have to give لحد ما يسمعوا الطق. Yeah, so it gives the relief. الطق ده it's like الكربون بيطلع and then the movement and synovial fluid the thickness بتاعته بتقوم بتقل and then the movement will be stable. I don't want to go through the slides. You got it?
Yes.
I still have time? Okay, 5 minutes. طيب. A dry needling. A dry needling إنك what you do, you palpate. So we have to know about functional anatomy. We have to know إنه it's not the anatomy أنا ما عايز the lateral third of no. You just know إنها هي جاية من وين وماشية من وين, and when it contract, it's shortening, بتعمل which movement, a desired movement. And then the palpation, we palpate along the muscle عشان نلقى, it's a skill, it's not easy to get palpation عشان تلقى trigger point ذاتها. And some patient will be having like huge trigger point that إنها هي بتدي so many twitch when you do, and then we have to be careful للناس اللي بدوا dry needling يعني. فالدراي needling is really relieving. ليه؟ how الفسيولوجي بتاعها effects بتاعها كيف؟ إنه هي بيقول لك نفس الحاجة القطيعة. So this is what they say a trigger point. So المايوسين والأكتين بيكون إنه في a lot of muscle sickness ولا I did sudden movement that causes my myosin actin to contract. ولا sometimes إنه في neurological cases بيكون في imbalance of the signals بتاعت البرين بتمشي للمصل بتقولها contract, relax, contract. So the muscle gets confused ما بتعرف إنه contract ولا relax, so it goes like this. So دي بتعمل لي a lot of trigger point combine مع ولا spasticity بعد ذاك بتبقى لي نفس neurology. So we have to palpate, we find the trigger point, we go along the muscle fibers from the origin لحد الانسيرشن بتاعها, and then if I want to check the muscle, I ask the patient to do the same movement. يعني if I'm working on the biceps بخليه يعمل supination and then بخليه يعمل flexion. That's why إنه أنا بلقى المسل ظاهرة and then I will be able to palpate. And there is different type of palpation. يعني يا إما pincer يا إما flat palpation. This is another thing. So the physiology of the dry needling, how it works, after I palpated in a good position للpatient, good position because I don't want to harm myself, good position للlimb ذاته عشان الpalpation بتاعي يكون أسهل. So I'll start palpating from the proximal to the distal area. I found my trigger point, and then the hygiene, we have to take about the hygiene, we have to sanitize. We should preferably طبعا wear gloves for that, which I don't do. And then we insert where the trigger point, and then you go along the muscle. You will feel إنه في resistance that's coming from the muscle itself. So there is resistance, you stop for a while. ليه؟ لأنه أنا ما عايز أعمل trauma للجسم. You stop لحد ما المسل it relaxes شوية شوية, and then you can go deeper. It's just like the same as how we do myofascial. We give exact amount of pressure شوية. When you feel the relief, you can go deeper more. And thank you. Can do more.